Welcome to the Island Doc.
Today our topic is diabetes, and we wanted to find out exactly what the population knows about diabetes. So myself and Dr. Gordon took it to the streets. Let's take a look.
I know that diabetes is a disease that can affect many people. I understand that it can be hereditary, and I understand that there are different types of diabetes, types 1 and types 2, but I don't know what the difference is.
Diabetes is a very serious and dangerous health issue, especially in the African American society. My father has it, my grandmother has it, and my great uncle has it.
From what I know about diabetes, it's a condition which affects a lot of Black Caribbean people. My dad was diagnosed with diabetes, and what it would have done, it would have basically affected your organs. It affects your organs like your kidney, it affects your liver, and if it's not treated properly, it could also lead to amputation. For example, if you were to get a cut and you're not aware that you have diabetes, in the Caribbean what we would say turn to gangrene, and then you would have to have that part of your body amputated. If it's detected earlier, it can lead to amputation of an entire limb, an entire hand. So people, go out there, get tested, know whether you have diabetes or not. If you do, take the necessary precaution, exercise, change your diet, and if you're given medication, ensure that you stick to it and check your doctor. Do not miss any appointments. Thank you.
You've seen it from those guys out there. They're actually pretty knowledgeable about diabetes.
Yes.
I mean, we've heard the words thrown out about insulin. You've heard about gangrene. You've heard about amputation. I mean, those guys out there are pretty knowledgeable. But what exactly are they talking about? What is diabetes? Diabetes results because of an elevated blood sugar.
Yes.
Now, there are two types of diabetes. There's type 1 diabetes and type 2 diabetes. Type 1 diabetes occurs when you have some sort of insult that happens to the pancreas, causing you to have...
Autoimmune.
Right, some type of insult. They think it's autoimmune, they think it's environmental. No one knows 100% certain. But anyway, the insult to the pancreas causes you to not be able to produce insulin. And that's the key molecule. Insulin is a molecule that allows sugar to be absorbed into cells.
Sugar?
Yes, sugar. So, without insulin being around, the amount of sugar that you have in your body goes up. Type 2 diabetes, you have enough insulin, but your body cannot respond to the insulin.
Yes.
So you have an insulin resistance. So type 2 diabetes is insulin resistant diabetes. And this is one that's related to obesity and lack of exercise.
Yes.
So this diabetes is the type of diabetes that where your insulin is not responding. And since your insulin is not responding, that sugar that should be going into cells is also going up.
Yes.
Because that sugar level is going to be elevated, it starts doing some naughty things.
Yes.
It starts being deposited in areas.
Eyes.
Right, it starts being deposited in your organs, so your eyes, to your liver, to your kidneys, to your nerves. Starts doing a lot of damages. So that is why high amounts of sugar is very, very bad for you.
Yes.
Now I'm just going to walk you through what happens when you consume a meal.
Yes.
On consuming the meal, it goes down through the esophagus, it gets into the stomach where it encounters all the digestive enzymes which break it down. It's absorbed and goes into the bloodstream.
Yes.
And passes towards the liver where it is also broken down a bit more, and the amount of sugar in your body starts going up.
Yes.
When that sugar is in a high concentration throughout the blood, it's the job of insulin to work on that sugar and pull it into cells. So processes that cause you to have a lot of sugar in your blood leads to diabetes. Now I want to make something clear so that you can understand. When I refer to sugar, it doesn't necessarily mean sugar as in white granulated sugar or brown sugar or sugars that can be found in your tea or in your coffee.
Yes.
Complex carbohydrates.
Yes. Bread.
Bread.
Rice.
Rice.
Potato.
Right. Are broken down into sugars. So when you are doing your caloric intake for the day and trying to decide and planning your menu, you have to take into consideration that the pastas, the rice, the bread, they do contribute to the amount of sugar that you will have to consume in a day.
Yeah.
So you have to ensure when you're planning your meals, your rice portion,
It's a handful.
it's a handful. You have to account for that sugar that you're going to have to. So the key to treating diabetes is to try to reduce the sugar intake. And more importantly, for patients with type 2 diabetes, as I mentioned before, insulin is used to bring that sugar into the cells. Type 2 diabetes, they have lost that function. But you know what works? Instead of insulin, exercise. Exercise has been shown to replicate what insulin does. And when you exercise, sugar goes directly into your cells. So for a type 2 diabetic, it's very important to be active, to exercise. It decreases the need for that insulin. We're going to take a break now, but when we come back, you will hear from our expert on diabetes. Stay tuned.